Welcome to the Invite Health podcast, where our degreed healthcare professionals are excited to offer you the most important health and wellness information you need to make informed choices about your health. You can learn more about the products discussed in each of these episodes and all that Invite Health has to offer at www.invitehealth.com/podcast. First-time customers can use promo code podcast at checkout for an additional 15% off your first purchase. Let's get started.
A recent report came out why you should pay attention to inflammation. Now, they're saying inflammation, I'm going to quote from their report, inflammation is a complex reaction triggered by your immune system when it fights invaders. So we're talking viruses and bacteria and yeast infections. So this is a Dr. June Lee. He's in the Nutrition and Epidemiology department at Harvard School of Public Health up in Boston. So they go on to say when inflammation is responding to an injury or an infection, such as a bacteria or a splinter, it's called acute. That means sudden, rapid onset. So the immune system releases chemicals. These cause your blood vessels to expand near the injury. This allows more blood to reach the injured tissue. And then chemicals are released at the injured point to attract immune system cells where they can help fight infections, and they also help with the healing process. So there's a Dr. Paul Ridker. He's the director of the Center for Cardiovascular Disease Prevention at Brigham and Women's Hospital in Boston. He said the flu is an exact example of acute inflammation. He's also a professor of medicine at Harvard Medical School. So he goes on to say when you have the flu, your muscles ache, your joints ache, you feel cruddy. That's because all the immune cells in your body are talking to each other, saying, hey, there's a foreign dangerous invader here. We've got to attack and we've got to get rid of it. So he goes on to say that's a massive immunological response driven by these things called cytokines. Now, you might have heard cytokines with COVID-19, that infamous cytokine storm, especially centered around a cytokine called interleukin-6. So let me digress here with a little dogleg of information. When people get an infection that attacks the lungs, the infection itself inflames the lungs. But then there's a counter-strike by the immune system to save the patient. And what can happen, especially it seems if you're low in vitamin D, you get this massive assault triggered by a chemical messenger of the immune system called interleukin-6. And you can have acute respiratory distress syndrome where the lining of the lungs literally floods with fluids and it's hard to breathe and you wind up in the intensive care unit. So this can happen if things are out of control. So that's acute inflammation. Now, usually they treat acute inflammation like that with steroids like hydrocortisone or Medrol or prednisone or prednisolone. Or they might use an over-the-counter medicine like ibuprofen or Aleve. But when inflammation keeps simmering along at a low level, that's called chronic inflammation. Now, a lot of things can trigger that. Drinking a lot of alcohol, if you're obese, if you have diabetes, if you're stressed out all the time, if you smoke cigarettes, if you're inhaling pollution from trucks and buses all the time. But it's low grade. So we're not talking about like feeling any pain or anything. You don't even notice you have it. You'd have to have a blood test to see you have it, and I'll explain that in a minute. But this chronic inflammation has been linked to nasty things. The onset of Alzheimer's disease, the onset of Parkinson's disease, which is a different brain disease, different cancers, different forms of arthritis, diabetes, heart disease. They're all connected to this low-grade systemic inflammation. So Dr. Ridker, back to Dr. Ridker from Harvard, what we're talking about is a very, very low-grade inflammatory response that people don't notice. It's just in the background. That's Dr. Ridker. And in the 1990s, Dr. Ridker led a team. They did a series of studies that were the first basically to connect this low-grade chronic inflammation with an increased chance of having a stroke or a heart attack. He also led trials showing that lowering this inflammation could help protect people from heart problems with levels similar to that's provided by statin drugs. Now, those are those widely known, widely prescribed cholesterol-lowering drugs. So lowering this systemic inflammation can lower your risk of developing heart disease, stroke, and heart attack to the level that a statin drug can. So here's what you have to look for. And Dr. Ridker goes into this, but I've actually done episodes on this. It's a blood test called C-reactive protein. In fact, you could get a further algorithm, a more sensitive one called HSCRP. C-reactive protein is abbreviated CRP. HSCRP is a more sensitive value to really detect low-level inflammation in your heart and your blood vessels. So Dr. Ridker says, the guy from Harvard, some people have a more active underlying cytokine immune system than do other people. They don't know it. They can't feel it. Their doctors don't know it. And if you're not measuring CRP the same way your doctor measures LDL cholesterol, the bad cholesterol, you just don't know if you're one of those people who has this advanced immune response. So that's a problem. You don't know you have it. Your doctor doesn't usually check for it. It's a simple blood test. I get it done twice a year. So Dr. Ridker expects such screenings to become standard practice. Meanwhile, most doctors are not measuring the inflammation at all, he said. So patients have to ask for it. Now, getting back to Dr. Lee, the first doctor I mentioned from Harvard School of Public Health, he and his group did a study in over 210,000 people, and they were studied for more than 32 years. And Dr. Lee's team, they found that people who ate a diet that increased the risk of inflammation, they had a 46% greater risk of heart disease and a 28% greater risk of stroke than those who had an anti-inflammatory diet. Pro-inflammatory diet would lack fruits and vegetables. It would lack fish. There could be a lot of red meat. There could be a lot of processed meat like bacon and salami. Whereas and a lot of refined sugar, putting sugar in drinks, etc. A lot of sugary drinks. Those things increase inflammation. An anti-inflammatory diet would be along the line of the DASH diet to lower heart disease risk, along the line of the MIND diet to lower the risk of dementia, or along the line of the Mediterranean diet. So what would be in an anti-inflammatory diet? Fresh nuts, fresh seeds, olives and high-quality olive oil, several servings of fresh fruit a day, especially like berries and apples and oranges and pears, really high-quality fruits. And 3 or more servings of vegetables a day, high-quality vegetables like broccoli and spinach and broccoli rabe, salad, some fish. You can have poultry. Remove the skin, it'll be a little better. Low salt. That's a Mediterranean diet. And also like whole grains, like whole grain bread or whole grain cereal. So here's the message. There are constituents in food that can reduce your inflammation. Now, one such constituent is quercetin. Quercetin is a flavonoid. There's hundreds and hundreds and hundreds of different types of flavonoids. This is a particular type of flavonoid called a flavanol. The chemistry of flavonoids is very complex. So it's found in small quantities in exceptionally healthy foods like apples and onions and shallots and scallions, green tea and berries and like blueberries, and broccoli and kale and cherry tomatoes and citrus fruits. It's found in there with other good things. So research shows that eating these foods rich in quercetin helps lower systemic low-grade chronic inflammation, the kind that's really bad for the brain and the heart and the circulatory system and the immune system. But even with a good diet, the average intake of quercetin, according to research, is anywhere from 25 to 30 milligrams. So welcome to my episode, Quercetin and its influence on inflammation, lung health, and blood pressure. But I have to tell you, that's not all that quercetin can do for you. I have to do a separate episode in the future how quercetin can be useful in slowing the aging process. In any event, hi, my name's Jerry Hickey. I'm a nutritional pharmacist. I'm also the senior scientific officer over here at Invite Health. Thanks for tuning in today to the Invite Health episode of this podcast. You can find all of our episodes for free wherever you listen to podcasts, or just visit invitehealth.com/podcast. At this point, we have well over 300 episodes up there talking about nutrition and health. Please subscribe and please leave us a review. I'd love to know how I'm doing. You can follow us on Facebook, Twitter, and Instagram at Invite Health. The info on this episode is linked at the episode description, so let's get going. Here's a systematic review and meta-analysis of human clinical trials. It's in the European Journal of Clinical Nutrition. That's rather recent. A systematic review means they go onto all these electronic databases that collate research, like Embase and Ovid and PubMed and Cochrane systematic reviews. Then they perform a meta-analysis. They put all the studies together, and of course they're looking for studies, in this case, looking at quercetin and inflammation in humans. So they put all those studies together, and then they have to rule out the studies that they feel maybe they're biased, or they're not performed well, or they're just missing too much data. So they have to find the best of the best of the best studies. And when you put a whole bunch of studies together, it's from all different research institutions with all different scientists and doctors and a much larger population of patients, so it's a much stronger level of evidence. And if a meta-analysis based on a systematic review is done properly, it tells you if something either works or it doesn't work. And in this case, quercetin worked. 7 randomized controlled human clinical trials, placebo-controlled trials, that quercetin, if you use 500 milligrams or more, significantly reduces persistent, chronic, low-grade systemic inflammation. It lowers that CRP level. But it was at doses of 500 milligrams or more with a supplement. Now, once again, when you eat quercetin-rich foods, there is an interplay of other ingredients. So focusing on enough of these foods, which I do, it's very important. I make sure my wife does. I try to influence my kids and their wives also to eat this way, and anybody else I can. There's an interplay between a whole bunch of good ingredients. So if you eat a lot of these foods, for many people, it could lower inflammation, but not all. Sometimes you need more quercetin. It depends on your immune system and the way you release cytokines, etc. So it's a little bit individualistic. But in general, a great diet helps lower inflammation, but there are certain conditions where you need more. So in a systematic review, 7 human clinical trials, quercetin lowered inflammation, persistent low-grade inflammation, the kind that gets your heart and your brain and your eyes and your lungs. So there's a number of studies showing that quercetin is helpful with asthma and allergies. Now, they need to do more work on asthma. They also need to do more research on allergies. But I have to tell you, as a nutritional pharmacist, I've used quercetin in people with allergies for decades. It definitely works. It definitely helps with allergies. But the studies show it even helps with upper respiratory tract infections. So here's a recent study from Appalachian State University. It's a 12-week human clinical trial. It's 1,002 people. They gave them either placebo or 500 milligrams of quercetin or 1,000 milligrams of quercetin. Giving the higher dose of quercetin, like 500 milligrams twice a day, because quercetin usually comes in a 500 milligram capsule. That's pretty much the standard dosage. Giving the higher dosage, 500 milligrams twice a day, cut way back on how sick people got and how long they stayed sick for. So here's the figures. And it worked best in people over the age of 40. It rolled back the severity of symptoms, like a runny nose, sneezing, sore throat, etc., by 36%. And it rolled back the number of days people were sick with an upper respiratory tract infection by 31%. So 36% decrease in the severity of symptoms and a 31% reduction in the number of sick days. So I would say that works. It's in the journal Pharmacological Research. So what else can quercetin do for the lungs? It's an anti-inflammatory in the lungs. So here's UCLA, University of California, Los Angeles. It's their Johnson Cancer Center. They published their findings in the journal Cancer. And they're looking at different flavonoids do they lower the risk of lung cancer among smokers? And the answer was yes, by as much as 50%. They found epicatechin. That could be found in cocoa. It's found a little bit in green tea. Other catechins, well, they're abundant in green tea. And quercetin reduced the risk of lung cancer up to 50% if you were consuming all of them. So have your cocoa, have your green tea, eat your apples. But with quercetin in general, they said for every 9 milligram increase in quercetin, it reduced the risk of lung cancer in smokers by 35%. Now, of course, there has to be a ceiling on that. It can never be 100%. So here's a study from Yale up in New Haven, Connecticut. It's in the journal Cancer Epidemiologies, Biomarkers, and Prevention. That is a scary journal. I read it every month. I hate reading it, but it's important to read. Because you read all these things, it makes you paranoid. In any event, increased intakes of quercetin affects tumor suppressor cells, tumor suppressor genes that help prevent lung cancer in smokers. So there is evidence that quercetin, due to its antioxidant and anti-inflammatory effect, helps protect the lungs of smokers. But you know what? Similar occurrences happen to people who are breathing in air pollution, from trucks and buses and cars, but also from those boilers that heat the water in all these big buildings. So that's something. That's something, because a lot of people are exposed to pollution, and it's not like you're going to move. You're near your family, you're near your friends, you've been living there for decades, you're near your job. So it's not so easy to move. Well, you could take quercetin. So let's talk now. We spoke about quercetin and inflammation. So 1 quercetin a day would be enough for that, 500 milligrams. I spoke about quercetin and lung health. By the way, when I use quercetin for allergies, I give 500 milligrams 3 times a day. It's not the only supplement I use for allergies, and we get great results. I use the black seed formula with rosemary and cordyceps. I use a supplement called NAC, and I add quercetin, and people with allergies do fantastic. Even at the height of their allergy system, it just knocks out the effects of allergies. So, you know what? I better stop here. I have more to say on quercetin. Quercetin is a senolytic. It removes old, damaged cells, something that you lose the ability to do with age, which is very bad for the brain and longevity. So I'll have to do an episode on that. Quercetin has been shown to be very good for people with diabetes. It actually helps protect their eyes. They develop these sorbitol cataracts that generally go away, but quercetin has been shown to inhibit an enzyme system in the eye called aldose reductase, helping to prevent the formation of these baby cataracts. But it's also an antioxidant in the eyes. Quercetin's been shown to help with inflammation in the prostate, prostatitis, and inflammation that women can develop, interstitial cystitis, which could be very painful in the urinary tract and the bladder. Quercetin is good for stamina. It improves circulation. But by the same token, quercetin is good for high blood pressure. So I'm going to cut the episode here. We'll do a second part to this podcast where I discuss quercetin, its effects on the heart, and its effects on blood pressure. So thank you for listening to today's episode. You can find all of our episodes for free wherever you listen to podcasts, or just visit invithealth.com/podcast. Please subscribe and leave us a review. You can follow us on Facebook, Twitter, and Instagram at Invite Health. Hope to see you next time on another episode of the Invite Health Podcast, which should be part 2 of this quercetin podcast. And thanks for listening.